Very important update today, December 7th, on USA, Europe, seasonality, and all the crucial data around this viral issue. So Hope Simpson, we'll remind you, worked out the seasonality and the patterns of transmission over 50 years. So we leverage his work. So we look first, COVID-2 is super seasonal and regional, right? WHO at the end of July said it's one big wave, it's not seasonal, does not share influenza's tendency to follow seasons. That would have made it completely different than any coronavirus in history. And sure enough, it's not different. So you see here Italy, right, the deaths per million, right, back in March, and it fell off with community immunity and seasonality change. All during the summer, nothing happening, even though they took out all the lockdowns. Seasonality. And then it rises coming into the next season, right? Because not everyone is affected back here. So when you come into the winter triggering, right, you're going to have people affected. We show you Peru, completely different seasonality, right? Rising out here in mortality per million. And Brazil, similar region, seasonal, and it's the same, only less impact. Lockdown in Peru, military style back here with mandatory masks, but it's worse than Brazil with no lockdown. We see this again and again. Note that November 19, Brazil, SARS-CoV-2 is in the human sewage in circulation in the population, same as Italy and Spain, but they triggered completely differently, super seasonal. Also, nothing was really happening back here, at least no one was noting anything. But in September 19, from blood samples in this paper, they had 14% antibody positive for SARS-CoV-2 in September, only there wasn't really much impact. January it dropped, and February it was up to 20%, but it was heading into the seasonal trigger. So people should be aware of all this seasonality and how widespread the virus was in human circulation way back here before the triggering. We got also note we have 22 papers, 23 now actually, showing across 100 plus countries analysis, no correlation between lockdown severity and mortality per million in a given country. The population health and other factors like prior season severity were what drove that needle. So lockdown shown to be hugely ineffective, but also hugely damaging. Unsurprisingly, the WHO, culmination of 100 years of pandemic management science, in October 19 said no recommendation to quarantine exposed individuals once a virus is out and about in a community or a region. Not recommended, never mind quarantining or locking down of whole populations. They didn't even cover that because it would have been too absurd. But in February 2020, we threw out the rule book of a century and we copied China. For whatever reason. Now we look at deaths per million in a few countries. So we have Italy, which we showed, and Belgium. Belgium is getting its seasonal resurgence, and thankfully it's curling over. Italy probably also. But remember, they did get the first wave, but it was seasonally cut off and community immunity building, right? Then the summer, nothing happens, super seasonal. And then they get the second half, or they get the latter quarter maybe of their first wave, right? This is kind of inevitable, depending on various factors. So there you have it. Sweden, we see with no lockdown, pretty much similar, just pushed out a little, and they're beginning to curl over too, looks like. So again, the same result or better result with no lockdown, and they're now only number 22 in the league tables for mortality per million. So Sweden are way down the league tables with no lockdown. We'll show you other countries that are slightly different. Czech Republic, Croatia, Slovenia. They never got a first wave as such because seasonally they got cut out, right? So they were crediting themselves with lockdowns, etc. The reality is it was seasonality primarily. Long summer, nothing happening. Super seasonal. And then coming into the winter, sadly, they get their essentially first wave, right? But Czech Republic is turning over and these are slowing down very much in rates also. So the virus has an inevitability and it's independent largely of lockdown stuff. We look at Croatia a little closer. They did no lockdown. October 24th, they decided we're not locking down because they probably know what I know and what you now know. Lockdowns don't work. We'll look and we'll see that around October 24th, of its own accord, the infection rate, rolling case rate, fell down fairly dramatically. So the hump was turned and turned right down without a lockdown. If we look at Slovakia, it was getting huge credit recently because it did a massive coerced or forced testing regime, and they credited that with dropping this curve. But notice the drop in infections that happened around the time they did it. If we move that over here, we see that Croatia achieved the same without doing anything effectively. So this is rabbit's foot science. This is doing something, nature shifts, and then you claim the credit, which is quite clear here. We'll show you Belgium. Belgium has a very unhealthy aged, probably some challenges in hospital systems too, but certainly they're getting hit, though turned over and curled over very happily and quite quickly, like many other countries. We'll look and see that they did a 28th October hard lockdown when the deaths were right up. This is way too late to have any effect. And if we look at the rolling case rate, we see that it was falling and kept falling, right, leveled out, independent of the lockdown. The lockdown was here, right? So we see this everywhere. Czech Republic never really got a first wave, and it's curled over, thankfully. They did an October 22nd lockdown like Belgium, right? Way too late, and anyway, we know it doesn't work. We look at their case rate was falling already. They do a lockdown, and then it falls and matches pretty much Croatia and others who did later lockdowns. Made no impact. Nature follows its viral curve, regardless. Here's Croatia as a reminder. No lockdown, made a decision not to lock down. Look at the similarity of the behaviour. So the virus drives the dynamics, not the humans who do their rabbit's foot so-called science from China. Italy will show again. They're talking about doing a lockdown on the 21st. They're not doing one now because no one will accept it because they know the game is up, that lockdowns don't help. But they're threatening to do one on the 21st. Kind of like when the horses are long over the horizon and the door is swinging open wildly, right? We see here that their case rate has been falling right down through November, right? This is natural like the other countries we showed you. And they're talking about doing a lockdown sometime out here. Okay, there's no cure for stupidity. Ireland will show you 17th October was curling over on the positivity rate in PCR. But they did a full country lockdown on the 22nd, and that might have impacted this curve out here. But as you can see, the curve didn't change in the slightest. So a full country lockdown, 100,000 unemployed, and a disaster for society, depression, suicide, ruining everything, for nothing. You can see it in the hospital cases too. 21st October, curled over. The lockdown might have had an effect here. Nothing changed in the curve, because we know that lockdowns don't really impact the needle. ICU, similar story. No change. And only a few people per million people in Ireland at the peak, even in ICU, with a positive PCR. We'll show Florida to bring in USA. So Florida death rates are around 5 per million people per day. Back here, this is September 25th. The governor, based on the science and multiple professors he met with, said taking out all restrictions and banning mask fines. And the world went crazy. And they said, oh my God. But this is what happened to the mortality rate. They're doing as good or better than nearly every region in America. But they've taken out the lockdown and the mask mandates, right? So this just illustrates yet again, right, for the nth time, that lockdowns and masks have very little impact. They do ruin society, but they have very little impact on the viral needle. Also notable for Florida, the 10 most lockdown states in terms of cases rising and impacts, the 10 most lockdown states are worse than Florida. Also for hospitalizations, also essentially for death rates. So Florida is running better than the 10 most locked down states, even though Florida has dumped the lockdown months ago and the mask mandates. And this makes sense because we have 22 or 3 papers now and analyses showing that lockdown doesn't move the needle. It creates excess mortality, true, and it creates societal dysfunction and distress and suffering, but it doesn't move the mortality needle, the important thing that it's intended for. And we, of course, know now without question that the WHO in October 2019 were entirely correct based on 100 years of science, right, and research. You don't quarantine exposed individuals when a virus is out and about in a community. That's only for island nations very early on, when you've got a couple of people maybe coming in and you stop them bringing the virus into the country. But you certainly don't lock down populations. So WHO 19 before they and everyone inexplicably copied China science. Looking at the UK now, we see the lockdowns occurred actually, if you account for lag, after the peak when it was turning already. The lockdowns all ended, and this is mortality, this is mobility. Everything ended here when seasonally, super seasonally, the thing was gone anyway, and community immunity accounts for the rest of the drop. Now we get a bit of a resurgence in the winter, but notice that the actual lockdown they've done in UK and are holding to came after the event, right? And the tiers they brought in, nothing really impacted the curve at all, except you could say the mandatory masks in midsummer, which again is inexplicable, anti-science. That kind of occurred in the run-up to the increase in the winter, but there's nothing, no other signal. Looking at the log scale, this is fascinating. Here's the virus, and as Professor Levitt said, and he was entirely correct in February from the China data, the virus spread and impact on mortality is slowing down from day one. So the rate of increase of virus is slowing down from the very start. And this is in line with Hope Simpson and every other historical bit of science. So you can see when the UK advised self-isolation in February, the curve never changed. When the schools were closed and then they put in a lockdown, the curve had curled right over and then it came down its gumperts, right? And these have always been the same in history, when there were no lockdowns or when there are lockdowns. Makes no difference. Again, we see that mandatory masks ironically came in and heralded in the increase. But the lockdown, big lockdown in the UK, these came after the curve was turning around and coming down. So we see it for nearly every country. And again, we have all the analyses that validate that. We can't say the science isn't there. It is there. It just says the wrong thing for the lockdown narrative. And the papers are here at this link. And again, we'll remind you the WHO knew this back in November or October 2019. They said no isolation of exposed individuals when a virus is out and about in a pandemic. And they didn't even say anything about locking down societies because that would have been laughed at until China made it serious. Now all-cause mortality high-level view in Europe from Euromomo. And the first thing to note is you can only compare seasons, respiratory seasons. You can't cherry pick like the FT have done 1 month or 1 week or 2 weeks in a given zone and compare to a different period from prior years. You must compare seasons in their totality. So we see now that 2017-18 winter season had 140,000 excess deaths in the older categories. 18-19 was very low. This is an approximation here from the curves, but very soft season. That's going to make the next year pretty nasty. And sure enough, when you note that the start of 1920 season, early last year, was incredibly low because influenza, it looks like, was kicked out of the virome by the new kid on the block, SARS-CoV-2. So there was nearly no impact here. So you had this soft season followed by an incredibly low season up until March. And then SARS-CoV-2 triggered, so it was quite severe, sadly. Total figures around 185,000 for the 1920 season, right? Following a soft one and not a huge amount more than 18 or 17, 18. So you got to keep this in mind. These are the numbers. What will happen in 2021? We've entered the season now a little early because that's the triggering of COVID-2. Every virus has its own patterns. Well, let's bring over 18 and look at it here. What if this year coming up until next April was like 18? We'll bring it down. It could very well be. In fact, it's looking like that. But in 18, there was no panic, no problem, and business and life went ahead. But in this season coming, it looks like we're going to ruin everything. And we know lockdowns don't really work, so that's kind of criminal. We'll just do it for the 65 plus years, and you can see again the similarity with 18. We bring it in there. It could very well look like this. But that never would have caused us to destroy our societies before. We'll just look at all cause in the United States now. And actually, we'll start with corona death rates. These are all deaths within 28 days of getting a positive PCR. And it's around 5 deaths per million per day, generally speaking. Okay, so not dissimilar from Europe overall. But you can see that most of Europe now is way higher in deaths per million per day, all these different countries. Okay, because they're experiencing many times their first wave in essence. So this is the corona deaths. But now there's an important thing to do. We got to look at excess all-cause mortality in the US because that's really what's happening. These are badged with PCR. There may be a huge over-attribution. So let's take the all-cause excess and bring it down here and compare it with the corona named deaths. And we get this. So you'll notice something interesting, that the corona deaths during the actual epidemic waves, and this double hump pattern is classic for the USA because it's multi-region, multi-season, if you will. So we always see this double hump in the past, and we see it here. But the mortality tracks with the SARS-CoV-2 PCR positive attributed deaths until here. So we only have all cause from CDC up to the end of October. But note the divergence, right? Very, very significant. So it should really follow this pattern. And while there is some lag, this data from all cause is back, a month and a half ago. So there's an enormous gap developing between the SARS-CoV-2 attributed deaths, which everyone in the world is looking at and thinking it's as bad now as it was back here, but the actual all-cause mortality is tracking historical trends for influenza pandemic type scenarios. So we got to watch the all-cause mortality like a hawk. The other thing is that the lockdowns will induce more all-cause mortality deaths. They'll cause deaths over the longer period. So that makes this even more striking. So everyone needs to understand this about the US to put things in perspective. Sweden we'll finish with. Again, they did better than around 22 other countries, even though they did no lockdown. And if we look at all cause for mortality for Sweden, it's a bit like the US. So back when there was SARS-CoV-2 attributed deaths in the actual epidemic, the all-cause mortality in Euromomo kind of matched it. Lower numbers, but followed the trend. But look now as they're counting in Sweden SARS-CoV-2 attributed deaths, the all-cause mortality lined up is showing next to nothing. So it's very different out here, a bit like the US. There's a attribution of deaths to SARS-CoV-2, but they're no longer resulting in actual deaths in the main. So we got to always look at all-cause mortality excess to know what's actually going on beyond the badging of deaths with SARS-CoV-2 positive PCR. Sweden we'll give perspective too. Here we have the Spanish flu, right? That was a big monthly spike because that was a once-in-a-century type pandemic. And here we see 76, 88 and 93 flus, and they have substantial monthly spikes, but no one did anything back here. And let's look at COVID-19 or SARS-CoV-2. kind of doesn't even match up to a couple of other ones in the past few decades. And this is with no lockdown. And we know lockdowns don't really move the needle anyway. So that's actually SARS-CoV-2 in Sweden in actual perspective in terms of mortality impact, all in one picture, which I hope you'll clip and share. Ireland is the same, and we're close to the end now. The actual epidemic of SARS-CoV-2, COVID, in Ireland in the first 5 months of the year hit mainly in April. But you'll see the all-cause deaths per thousand population. 2020, during the actual epidemic, was no different than prior years, even though it followed a soft 19. In fact, the peak month of SARS-CoV-2 epidemic in Ireland, with the media screaming about the death rates, doesn't even really beat January in 17 and 18, where there was no media coverage, except full trolleys in the hospitals and there's a bad flu and the health system can't keep up, all that kind of stuff. But we kept our country running, our economy thriving, our young people living, right? We kept people away from depression and suicide and business failure. That's what we did back then. Good job to us all. But this year, we decided to put a match to it and burn the whole lot. And we know it didn't even help. So, I'll finish again. We have 22 papers analysing the actual data, and there's no correlation between lockdown and actual mortality per million across all the countries. And that lines up with everything I've shown you and everything we're seeing. And yet the world still thinks otherwise. And that's because of media and because of medieval superstition-style science that we borrowed from China. And it looks like we like it. And we want to keep it. And remember finally, the WHO, October 19, clearly called out, right, from all their knowledge and wisdom and worldwide Western data on pandemics, quarantine of exposed individuals is not recommended, right, because of lack of evidence. And they were correct, right? Never mind locking down whole countries, which is quite frankly, at this stage, based on the science and the actual data analysis, is absurd. And just a reminder that I do need support to continue putting together all of this content, and at patreon.com/Ivor Cummins, or for PayPal at tinyurl.com/Ivor Cummins, where you can do a one-off or a monthly support. So I'd really appreciate that, guys, and keep me getting the science out there and countering perhaps the more biased corporate type science. Thank you.